Welcome to the Empowering Family Caregivers video show. Today is Friday, April 15th, and I'm very pleased to bring to you today a whole discussion about occupational therapy, that is geriatric home-based occupational therapy. My name is Susan Baida. I'm your host and also co-founder of eCareDiary.com, who is bringing you this show today. We're excited to have with us Nicholas Lampiasi. Am I pronouncing that correctly?
That's correct.
Great. And Nicholas is from Fox Rehabilitation, which is a Medicare Part B provider of physical, occupational, and speech therapies. So this is a new subject for us on the show. This is the first time we're talking about occupational therapy, so we're very excited to have you to talk about. Well, actually, before we go into that, let me tell the audience a little bit about Nicholas. He is a New York State licensed occupational therapist and the Senior Regional Director of New York City, Long Island, Fox Rehabilitation Services. Nicholas directs 46 physical, occupational, and speech therapists who provide over 1,300 skilled home-based therapy visits a week to the greater New York City geriatric community. He is also a rehabilitation consultant for the New York Post newspaper here in New York City on geriatric rehabilitation and techniques that allow older adults to live more safely in their homes. And you can learn more actually about occupational therapy. There's an educational website which is www.foxgeri.org, and that's spelled FOXGERI.org. Welcome, Nicholas.
Thank you. Glad to be here.
Thank you. Well, I really am excited to learn more about occupational therapy and how, I think the whole concept is about helping elders live longer and independently in their own homes. So for our audience, can you start by explaining to us exactly what is occupational therapy and why do our elders need it?
Sure. It's a tough definition because it's not as straightforward as physical therapy. It's developing a person's skills and their caregiver skills, strengthening, balance training. It involves every function of the body, really, to enable them to be able to live safer in their home. Anywhere from the simple things of brushing their teeth all the way up to going shopping in the store and using an ATM machine. So it incorporates everything that's involved with life, and whatever is important for the person is important for that occupational therapist to try to get them to do better, or the way they used to do it maybe when they were 25 or 30.
You know, I remember in my family's experience, the term activities of daily living came up. Is that what you're talking about here?
It is. It's getting, I guess, more known, that term. There's activities of daily living which go anywhere from, like I said, self-feeding, grooming, bathing, dressing, toileting, and transferring, higher to independent activities of daily living, which are instrumental activities of daily living, which is shopping, grocery store type of activities, banking, writing checks, doing your bills, the higher functioning type of activities.
So tell us, what are some of the common therapies of occupational therapy?
Sure. General strengthening, balance re-education, compensation techniques. So if somebody has a lost function in their body, like if they've lost the ability for depth perception, let's say, for vision, they can't tell how far things are away, using their other resources in their body, like touch, to determine and make up for that loss. So it's a lot of education, and it depends on people's cognitive levels, whether they can follow through with instructions, or do we have to involve caregivers to educate them so that they're with their family members or clients on a daily basis, that they can continue that instruction.
Right. Now, you mentioned, or I mentioned, about your services being home-based. So why are your services home-based as opposed to based at a facility?
Right. It's because we treat specifically the older adult. You or I would be probably better getting stronger in a gym using weights and machines, but with an 85-year-old lady or man, the evidence has shown that within their own environment, utilizing their own furniture, their own steps in front of their home, or their own 5-block radius here in New York City, we can practice within their own environment to get those results much better than simulating them at a outdoor clinic.
That makes a lot of sense.
It also increases their compliance, so when it's raining, snowing, or 100 degrees in the middle of the summer, the therapist goes to them. And so we get a better outcome of having that 2 or 3 times a week versus, oh, it's raining, I'm going to skip therapy today because I don't have a ride,
right,
or it's just inclement weather.
That makes perfect sense. So now, tell us, what is the main reason why you get referred?
The main reason in our clientele is falls, and trying to either fix a person after they have a fall, but moreover, to try to prevent that fall from happening proactively. So if somebody is walking down the street using a shopping cart, but they're really not using it for shopping, they're using it for balance, and so they don't fall, those are great folks to try to work with their balance before the inevitable crash.
Right.
So that our job is to retain folks in their homes safely and reduce the risk of having to go to the hospital.
Now, I mean, speaking from experience, my father-in-law fell numerous times and ended up in the emergency room before we could address, I think, what you're suggesting, which is training him how to, walk or regain his balance before that happens. But I think many families out there are like us and, didn't anticipate these falls. And so how are most of the referrals from doctors, like treating the patient right out of the emergency room?
No, most of the referrals actually are from their primary care physicians, and we educate those physicians on, these are some things you can look for.
Right.
When your patient is coming in to do their 2-month follow-up visit or something like that. Right. So it's trying to catch the fall before it happens, in a sense.
That is so.
But it's hard because at the same time, you or I, myself, I sometimes need a little motivation to do things, and until I have something really bad, I don't fix it. So it's also encouraging people that if they do identify something that is going to get worse, like balance, for example, it's better to catch it now than after you fall and are in the hospital for a week and then having months of therapy just to recover from that fall.
Does the educational website that you mentioned earlier to me, the foxjerry.org, have information for families?
It does.
On these type of issues?
It does. It has topics of falls, caregiver education type of tips to look for, home environmental type of modifications that are simple.
Wonderful.
Things like that.
Let's talk about that. Or you know what? Actually, before we talk about some tips, because I'd love for you to share some tips with our audience.
Sure.
But you address issues of dementia and Alzheimer's. There are a lot of issues with, occupational therapy with those particular diseases. Can you talk a little bit about that?
Sure. It's the way that you present yourself in front of somebody that is with dementia or any type of dementia is much different than you would confront yourself to somebody that doesn't have dementia.
Right.
There's certain speaking patterns, slower, giving them time to respond instead of thinking, oh, they didn't hear me, I'll just talk louder. They usually can hear you unless there's a severe hearing deficit, but it takes a while for their brains to process the information.
Right.
And once you add another direction or another verbal cue, they have to think of that now, and it takes them more time to process that information.
Right. So you help train families in how to communicate better.
Yes.
With the patients. So this is speech therapy, so how to.
No, from physical, occupational, or speech therapy, it all involves educational training to the caregiver as well, whether it's a hired caregiver or a family member.
Great.
So that they can be less frustrated.
Right.
And empower them to hopefully make their lives easier as well while caring for their loved one or their client.
I've encountered families who don't know how to address these issues, and they don't know where to turn. So I'm not sure in the cases actually that I'm familiar with that families would know to turn to a therapist, I guess, for assistance. So how do you reach dementia, Alzheimer's patients? Is it through the The primary care physician?
Yep, it's usually through the doctor. It's got to get to the doctor somehow because we need a doctor's prescription to treat.
Right.
But geriatric social workers, care managers, those are also avenues for referral and communication.
Right. Great. So let's talk. Let's go again now back to falls, because I think being that that's one of the most common reasons why you're referred. What are some, I guess, misconceptions about it, and ways in which families can help the patient prevent?
Sure. A common misconception is to just give a loved one or your caregiver a cane or a walker. These are assisted devices to help ambulation and transferring.
Right.
And they need to be trained for properly. It's like a doctor giving you a cardiac medicine for your heart, but not giving you any instructions how many times a day.
Right.
So these type of things need to be trained by a professional that's skilled in treating and training those type of devices, so that device doesn't go the opposite way and be a deterrent for them and actually cause them more harm than good.
Right.
Because they don't know how to use it properly.
Right. And I made the mistake of getting my mother a walker after her surgery, and she couldn't even lift herself up. So, I mean, she ended up,
and that's,
crawling.
That's right. Walkers are to walk.
Yeah.
There's some phenomenon that walkers, once in front of a person, they automatically use it to stand up with, and that's not what walkers are designed to do.
Yeah.
So there's a common misconception right there that it's across the board. We see it all the time, breaking that habit of using your hands on a chair to stand up instead of depending on that walker to stand up, because that's just to walk.
So, all right, Nicholas, can you share with us now some tips on how we can help our elders, prevent our elders from falling, even in their own homes?
There's 5 simple tips that everybody can try to give a shot. It's mainly, now that the weather's getting nicer, wearing the proper shoes. Right. Flip-flops, open-heeled sandals are not good for people that are having balance problems to begin with.
Right.
So those fuzzy slippers with the open heel, they're better to have a slipper that goes all the way around the foot, more like a shoe. So that's one. In the wintertime, it's usually better because people have warmer shoes on, but in the summertime, it is common.
Okay.
Environmental hazards, such as those little fuzzy throw rugs. If you have a beautiful oriental rug that you can't get rid of, that's fine. You can tape it down. There is rug tape that you can buy.
Edges?
Yep, tape the edges so that toes don't trip over that lip of the carpet.
Put the tape
of the rug
on top of the edge and then down on the floor.
Right. So half the tape is on the rug, half the tape is on the floor.
Got it. Okay.
It keeps, and if you're using a walker, the walker doesn't ruffle it up so that the walker tips over and so does the person.
So it sort of like acts like an incline.
Correct.
Like, okay.
And it keeps it from tripping.
Great.
Talk to your doctor about your medications that your loved one might be on. Doctors nowadays are less inclined to over-medicate as they used to be, which is good, especially heart medications. They used to have like 2 different high blood pressure medications, but don't ever take away something without talking to your doctor.
Right.
If you have more than 4 medications, you're much more likely to fall, and some people are on 15, 20 different medications, and they all interact with each other differently.
And they get dizzy and lose their balance, so that's
right.
The reason.
Okay.
Anything else?
Yep. I mean, exercise. Without movement, you're one step closer to not moving at all.
Okay.
So the more exercise you get, stay active. Whether that means if you're still capable of doing a group exercise, if you're in that level, or if it does require skilled therapy, then that might be an avenue you want to go down.
We're not talking about like aerobics or cycling classes. We're talking about very
Tai
easy,
Chi, yoga, those type of things keep you moving. But if you need more than that, you might want to talk to your doctor.
Okay, Nicholas, we have, I think, less than a minute. And how can physical, occupational, in some cases, speech-language therapists help with reducing the risk of falls?
Well, because we work one-on-one with the patient and the resident, so are we done?
It's okay.
We work one-on-one. There's no group therapy, and we educate and promote independence for both the caregiver and the patient, so that they're not caught up in generic therapy. It's specific to that person.
Great. Well, Nicholas, thank you for joining us today, and I want to thank our audience for joining us as well, and tune in for our show next Friday. Take care.
Thank you.